Welcome to the Cat Café podcast, your go-to place for all things feline. Join Dr. Susan Little and Dr. Jolle Kurpenstein as they share expert advice, practical tips, and the latest cat news, helping you keep your cat happy and healthy. Grab your coffee or catnip tea and let's talk cats.
This is Dr. Susan Little.
And this is Dr. Jolle Kurpenstein, and this is...
The Purr Podcast.
No, the Cat Café podcast.
Lord.
Oh, there she goes again.
So close.
She was. I knew that
I
this
was so close. Okay.
98.5%.
And this is the Cat Café podcast.
Yes, thank you very much. And very excited to be here. We're in Anaheim, California.
Anaheim, California.
For the AVMA convention, which is a big convention for veterinarians. AVMA is our American Veterinary Medical Association, has about 110 or 120,000 veterinarians associated with it.
Wow.
So this is a big conference that we do here. And we're going to talk about a very specific topic, which is stem cells in cats.
Stem cells in cats.
And we have a special guest.
Yes, I'm Dr. Rebecca Windsor. I am a veterinarian and I work for Gallant, which is a company that's developing stem cell therapies. And we're starting with cats. Our first two products are going to be for oral disease in cats and for osteoarthritis in cats. So
Very exciting.
Amazing. Yeah. And this episode made possible by an educational grant of Gallant. So we're very, very appreciative of that.
Made it possible to do this, which is very exciting for us.
Yeah.
What is it? What is a stem cell?
What is a stem cell? So stem cells are, they're cells that live everywhere in our body. And the whole purpose of the cells is to help repair tissues whenever we have, damage in our tissues. And so sometimes they work great. Sometimes they don't work so great. Sometimes you need to help support tissues that have damage by giving them additional cells. And so we're actually able to remove some of these cells from healthy tissues and narrow them down to a really strong population of cells. And then we can give them in patients that have diseases to try to help that tissue and that disease get corrected in a kind of more natural way. That's one of the things I like about it.
That's true.
Is you're taking something from the body, putting it back into the body.
That's true. It's not a drug per se.
Yeah, it's considered a drug, but it works so different, right? I feel like I oftentimes think of drugs like as robots, like they're targeted to do a certain thing, they're programmed to do a certain thing, whereas
and they're not naturally occurring usually.
Yeah, stem cells are alive, so I think of them more like paramedics, right? You like put them in the body, they figure out where to go, they know how in that environment to try to
do their job.
The tissue. Yeah.
I'm a cat owner. Can I recognize a stem cell or what it? Where are they?
So, well, I mean, you name it, they're everywhere. So you figure, you have cells in your body that have different functions, but in order for them to get there, there's got to be something kind of behind them. They're almost like the creators, of the other cells.
Like a conductor.
Yeah, it's like they're sitting there. If you sit there, like sitting in the background, kind of ready to like step in if there's something wrong with those cells, right? So you figure over the whole course of your lifetime, your tissues are always kind of regenerating. Some cells die. Well, then you need to have new cells come, right?
So we have sort of a constant replacement process going on.
Exactly. So the stem cells that are in there are there to kind of help replace. And in addition to that, they work to help heal some of the tissue that's there too. So not only just forming new tissue, but like making sure that everybody is well balanced to be able to heal.
There are different sets of stem cells.
Yep, different sets of stem cells. And they've gotten a bad rap because a lot of people have thought of stem cells that come from embryos.
Yes.
And that makes us feel really creepy,
Yes.
And I will say it's very uncommon to use those at all. And
that's more
in people
technology, I think, right?
Yeah. So most of them are coming from tissues that are pretty easy to access. Our particular company gets them from uterine tissue. So cats are just getting spayed.
What is the uterus?
A uterus is a organ that this is one of the things I love about the uterus. I geek out on this is that, it's, if you think about it in people, it's actually one of the most highly regenerative organs. It turns over once a month, right? There's like 30,000 times or something in the course of a lifetime it reforms itself, right?
Okay.
And then also
so it needs a lot of stem cells.
And it grows a new life. Right?
Yeah.
That's like
and then it grows a new life.
It's even better.
Yeah. So they're thinking about a source of tissue that can be the most powerful to really help heal.
Right.
Uterine stem cells are great. And so in cats, most of the time in our country at least, we're spaying cats, right?
Yeah. And then we're removing the uterus.
And where do we do it?
Makes sense.
Throw it away.
Yeah.
Right. And so instead of throwing
Not you.
we don't throw it away. Yeah. So instead of throwing it away, We have very, very small number of cat donors. Luckily, we get over 30 million doses of stem cells from
Really?
like
From one cat?
from one uterus.
So it's not like you need a lot of
No,
uteruses every day.
we've had 5 cats probably ever.
Oh,
So
goodness,
yeah, really
5.
small amount of cats that
Wow.
I have needed to donate. So
Not only is it ethical, it's not like prone to taking advantage
no,
of.
exactly right.
Yeah,
Exactly right.
I like
Yeah,
that. In
yeah.
your company, you have very skilled laboratory people
Yes,
who
yes.
know how to take
They're the magicians.
the
Yes.
magicians.
Yep.
Yeah, I think they're like magicians too.
Yep.
And they know how to get the stem cells and just the correct cells out of the
Exactly right.
uterus, right?
Yep, yep. And we've learned so much over time. We can label those cells so we know what they are. So,
Yeah, so you can
yeah.
be exact on
Yep,
getting the correct
yep,
cells.
yep. But
Okay.
you have to have, really skilled lab
Yeah.
people that know how to do that. And there are lots of quote unquote stem cell therapies out there where people aren't doing that, right?
Right.
And so you don't really know exactly what's in there. So it's really important to,
How are
go through
they
the
able
process.
to do it? Because I know the products that Gallant is working on will need FDA approval, just as if they were a new drug,
Yep.
right? So
Yeah.
how is it other companies are able to like offer, I'm going to put it kind of in air quotes, stem cell therapies?
Yeah, that's a great question.
Yeah.
So I think some people don't want to be bad mouthing
No,
in
but
any way, but different creative ways of labeling things
yeah,
and stuff
okay.
has
So
allowed people
they're
to.
using some type of workaround, I guess, in
Yeah,
one way or
and
another.
yeah, exactly. And there's limitations to how much bandwidth the FDA has, I think,
Yeah,
for
yeah.
kind of going after,
Yeah.
even in human medicine,
Sure,
but
sure.
it's interesting. There's several companies in human medicine that are doing similar things to some of the things we're seeing in veterinary medicine that are being shut down by the FDA. But the
Yeah.
FDA just it's limited for what they
Well,
can
of
do.
course,
Yeah.
they can't detect everybody, but
Mhm.
there is a difference. I guess
Mhm.
that's what I'm kind of getting at,
Exactly.
right? So
Big
if you have an
difference. Yeah.
FDA approved
Mhm. Yep.
product,
Yep.
then it has rigorous like safety testing.
Yep. That is the most important thing. I think with
Right.
any of these drugs is we have to know that they're safe
Right.
and we have to know what's in them, right?
Yeah.
And that's what the FDA approval
Right.
assures you.
And that they work.
Yep.
Right. Yeah. So that's why it's
Mhm.
important to
Yep.
look for that
Yep.
type of product
Yep.
in this big stem cell market.
Exactly
Yeah,
right.
okay.
Yep.
Yeah.
Why should I be excited as a cat owner?
Yeah.
Stem cells.
Yeah.
So many reasons. So I think,
Haha.
I think we're recognizing so much more, so many diseases that affect our cats that are going on for a lot of their lifetime. And
Yeah.
they are the bravest of a species. We know this, right? They mask their symptoms, quite well, and
They do.
they're very brave. And we're learning a lot about how these diseases happen and why they happen. A lot of it is because their body has an immune imbalance,
Yeah.
and it's shifting things to cause their tissues to become inflamed.
Right. And that
and
causes pain.
yeah, exactly. And whether that's in the joints and they have, arthritis pain, or, in the case of the mouth, skin, I mean, kidneys, even so many different
Mhm.
organs, bowel,
Mhm.
they can get this ongoing inflammation. And most of what we're doing when we treat really any species, but certainly cats, is to try to make them feel better by giving them drugs that are going to stop those symptoms, right?
Right.
And that's great, right? We want them to feel
Sure.
better,
Yeah, and you want to
yeah.
reduce the pain and
Exactly.
sure.
But in the meantime, the disease isn't getting better,
Yeah,
right?
yeah.
And so it's getting progressively worse. And so we're trying to target those diseases with stem cell therapy because they can come in and reset that immune imbalance and help to heal that tissue again in a more natural way, with the hoping that while they're feeling better, they're actually getting better too, right?
Yeah.
Instead of just masking those symptoms. So
Right.
we have a lot to learn still.
I bet.
It's like an exploding area of research,
Sure.
but really, really promising results for a lot of different conditions.
Yeah.
So,
And especially for a really common type of disease in the mouth of cats
Yeah.
called stomatitis, right?
Yeah. Mhm.
Where they get, it's not just like red gums and
No,
which
yeah.
is common, but this is where really the whole mouth gets severely inflamed.
Really bad sores. So if
Yeah.
you've ever had a really bad canker sore in your mouth,
Yes.
imagine having massive ones in the
Oh
back
my
of your
gosh,
throat.
yeah.
I mean, it's miserable.
It's
a
miserable.
miserable disease.
That's a good comparison.
Yeah, I
Mhm.
actually that makes it very relatable.
Right,
So
Yeah.
right, because almost
Yeah.
everybody has had that. So
Yeah.
yes,
that's really struggle.
bite on your
Oh yeah, you
Yes,
bite on
then
your
you can't
cheek.
bite, and
no,
yeah,
yeah,
no,
that's awful. And then
Yeah.
every time when you try to eat, you bite on it again. It just
Yeah.
hurts, and it's
Yeah.
those poor kids. And the cats don't really show it as well.
Well, do you know what? I think they're more subtle.
Yeah,
And I
yeah,
think the
for sure.
biggest thing
Mhm.
to understand, especially for pet owners, is that cats can have a very sore mouth. They can have very bad teeth. and they will still eat.
Yeah.
Right.
But they might not groom as well.
Right.
They
There'll
might
be other
yes,
signs.
other signs. And so they're oftentimes quite subtle. So sometimes it's
Yes.
drooling, sometimes it's, hiding more, not interacting
Sleeping
the same way,
more.
sleeping more. And, it's interesting, as part of our studies, what we care about the most is that the cat parents feel like they're getting better, right?
Yeah.
Right.
The main outcome measures we look at are really unique to that cat. Like, what do you feel like your cat is doing that's different?
Yeah.
And how has that changed after stem cell
Yeah.
therapy? And the majority of the time, the things that we hear are not related to your point to eating.
Yeah, they're not.
They're usually grooming, sleeping more, hiding more,
Yeah.
not wanting to be pet as much. Those
Okay.
other ways. That
What were
cats
the
look.
results?
So, yeah, so pretty exciting. So, this group of cats that we've studied are cats that really have failed all therapy. So,
wow.
we call that group refractory. So, they've oftentimes had their teeth taken out, they've been on medications, and we're so sympathetic.
Even after you take the teeth out, it still doesn't hurt.
For a group of them.
Yeah, it can help
Yeah.
a bit
Yeah.
sometimes, but not
Yeah.
enough.
Yeah.
Or
Yeah.
not help at all.
Can you
Yeah.
imagine that you do that? You take all the teeth out,
Well,
and then
this
it's
is
still
frustrating
it
for
is double
veterinarians
frustrating,
because
yes.
we really
It's, I know.
have
But
the
imagine how frustrating it is for cat owners
Sure.
because it's just
not-
not very
yeah.
cheap to have that done.
No.
And
Yeah.
you think you cure,
Yeah.
Yeah.
but you also debilitate a cat
Yeah.
like that. So
Yeah, and although like this product has been developed in those cats that have had their teeth taken out, people are very actively looking into treating earlier with
Of
stem cell
course.
therapy.
Sure.
We'll see what those results look
Yeah.
like. So far we don't know, you
Yeah.
know what I mean? But yeah,
Yeah.
that's one of the biggest, questions we get. Can we avoid taking the teeth out?
Yeah, that's
Then the
right.
hard thing is it's a lot going on in that disease, so sometimes
There
the
is.
bacteria in the mouth and stuff are contributing too. So
Yeah.
Obviously, when there's dental disease, they need to go. I mean,
Yeah.
that makes it clear.
Yeah, if
But
it's a
we-
diseased tooth, it
Right.
needs.
yeah,
Right,
exactly.
right,
Yeah.
right.
But maybe
Yeah.
just that tooth,
Yeah.
not
Right.
necessarily taking all
Right.
the teeth. Yeah.
Right, right.
So
Yeah.
So the-
Gallant is an animal health biotechnology company creating a new category of veterinary care with a pipeline of off-the-shelf, ready-to-use stromal cell therapies targeting the root cause of disease in pets. Led by pioneers in veterinary regenerative medicine with deep expertise in development, manufacturing, and commercialization, Gallant is making regenerative medicine accessible, moving beyond symptom management to restoring health at the source. Learn more at www.gallant.com.
It's also really good.
yeah, really, really promising. So again, these were cats who were failing therapy. Looking at them at 3 months, 75% of the cats were improved.
Wow.
After the therapy.
And the thing that you did was you had to take them off all the medication. And that is
Yep.
amazing.
That's part of what you have to do in that part of the trial. We don't have to do that anymore, thank goodness.
Right.
But in that beginning stage, you just have to show it's just the stem
That's
cells
what,
working
what
and
your
not
company
nothing
had
else.
to do to,
Yeah.
to
But
prove
now-
the point.
Exactly.
Yeah.
Yep. And so you figure they're already not doing well, and then they're going off their meds that they were dependent on, and to have that good of a response is really
Yeah.
encouraging. So-
But in real life, it can be combined with other
Yep.
therapies.
And the studies we're doing now, we don't have to take them off.
Yeah, okay. Yeah.
Mhm.
Yeah.
So when I
Yeah.
when I think stem cells, I always think about that they have to inject them in awful spots. So do they inject them in the mouth?
No. Yeah,
Oh,
no.
good.
And luckily, they actually probably work best not going kind of locally into the tissue. And so we're learning a lot about this disease. And so we obviously know their mouths are really inflamed. They've got
Yeah.
these bad sores.
Right.
But what oftentimes is going either at the same time or maybe driving it is they've got inflammation in the blood as well, and inflammation in other tissues. So like in
Yeah.
their throat,
Which is hard
in their
to
esophagus.
detect.
Yeah, so giving them
Yeah.
soreness when they're swallowing it.
Right.
So and so the nice thing about the way that we give these cells is that it goes into a blood vessel,
Oh,
and
wow.
so it
That's
helps
good.
reduce inflammation in the bloodstream.
So it's good.
And they don't have to be anesthetized or sedated or anything like that.
Nope, not unless they have trouble with
Yeah.
the catheter, but
Right.
most kitties don't. I'd say it's pretty
Wow.
uncommon,
That's
and then they
This goes in an intravenous
Yep,
or
in-
into a vein.
Yep.
Right.
And
Like
then
any drug injection you might
exactly.
do.
Yep. And then the
Yep.
cells travel through the body. They're
Mhm.
able to then get to the mouth and reduce the inflammation and sores and stuff there. So what's interesting is that the cats, a lot of them feel better pretty quickly, and so it's actually so amazing. We've got so many great pictures and videos of some of these kitties that are like, for whatever reason, like we joke, they like get the munchies after the stem cells and they start chowing down and eating. That's like one of the side effects, or they start becoming a lot more affectionate. I
Sure.
call it like the stem cell high, that they seem to have
Yeah.
this like
But-
really immediate response.
But to your point, if there's inflammation and pain elsewhere in the body, let's say further down the throat, it's really hard. We wouldn't know it,
No, yeah.
right? Because you can only see so far down,
Exactly. Yeah.
right? And
Yeah.
it may be treating it in these more like less visible
Yeah.
areas,
Yeah.
right?
Yeah. And I think another really interesting area of research with stem cells is how they specifically work on the pain pathways.
Yeah.
Right? And so a lot of these kitties, they have these sores in the mouth, but what happens to the body when you're constantly getting stimulated to feel pain is
Yeah.
that pain just gets worse on its own. It like becomes its own, own
You
beast
get
there.
central sensitization, and then
exactly.
it just becomes a
Cycle.
self-propagating
Yeah, even if the
cycle.
disease isn't progressing that much,
Yeah,
they
yeah,
just are feeling worse and worse and worse.
yeah.
And so we're
Yeah.
learning a lot more about how the stem cells work for that. So it's interesting they're starting to use them for oral, mouth disease pain syndromes in people,
Wow.
for that reason stuff too. So it's really interesting.
Do we expect any side effects of this therapy?
Yeah, so I mean, all drugs are going to have some side effects potentially, right? So we always say nothing is ever 100% safe, but if you look at the safety profile, especially compared to a lot of other drugs, it's really promising. So what I usually quote is probably about 20% of cats have some sort of side effect, whether that's the cells themselves or just the stress of being in the hospital.
Because they have to
or
come in the
getting an
hospital.
injection.
Yeah, right.
And it's usually things that are kind of typical for stressed cats, like increased respiratory rate, drooling.
Drooling a bit.
Occasionally we'll have like a vomiting episode, usually not continuous,
Right,
but
right.
That would be the most common thing.
Right.
Usually it's pretty short-lived, like it'll get better on its own, within
And-
an hour or so.
Oh, very
Yeah.
quickly.
Mhm.
So if the kitty comes in to get its stem cell injection
Yeah.
and then goes home, it should be normal when it goes home.
That would be the typical. Yeah. So
Typical,
the
no.
unusual.
So
to
the
have it
owner
come
wouldn't
back with that.
expect to see any, typically wouldn't expect to see any issues.
We would not
Okay.
expect to see that. Yeah.
Okay.
So not that there isn't always going to be some exceptions and
Well, yeah,
but
but-
yeah,
but
yeah. From what
typically-
we've seen, yeah, that
Good.
would be unlikely. And if they needed to get an anti-nausea medicine or something,
Yeah,
we
that's
do
true.
that.
We have,
Mhm. Yeah.
that's probably what I would do. I would probably give,
Yeah.
a drug before the
Yeah.
injection and a drug for nausea.
Yeah, and I
Yeah.
think the problem with the stomatitis kitties too is again because they have this inflammation. We see it in the mouth, but they have it in the throat, the lungs, the esophagus. So they are already prone to
Right.
vomiting and respiratory things
Yeah,
with that
right.
condition. And so we watch them pretty closely, while they're getting the treatment. They usually get over about 30 to 40 minutes in the clinical
So
trials,
it's a
and then
slow injection.
just give a little bit, give a little bit,
Wait, yeah.
and just for that reason. and
So they'll be in the
tolerating,
clinic
okay.
maybe for a couple of hours, and then they go home the same day.
Yes.
Yep. Okay.
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 Yeah, and then they get 2 doses. So they get 1 dose and they get another dose a couple weeks later usually.
That's it.
Okay.
Wow.
Yeah, and that's it. And then the veterinarians will have the option to redose if they
Mhm.
felt like they needed to over time.
Mop it up over
So
time.
yeah, what I usually will say though is that again, it's a different type of medication, right? So we're used to giving drugs that are stopping things from happening, whereas the cells are going to get there and take the time that they need to kind of do what they need to do to heal the tissue. So sometimes that can take a little while, So
And how long are we thinking then? I mean,
yeah.
if I'm a cat owner, how long?
What do you want to know?
Okay.
I would say that I would give it 3 months at least for sure,
Really?
to see. But again, we have this group of cats that are like, seems like almost immediately better. And looking at percentages, half the cats were better just after a single dose. So that's at a 2-week mark. That gives you a good time point to see there. But again, for some cats, it's going to take more time. All different stages of disease and
Right.
how long it's been going on, how aggressive it is, and so some might take a little bit longer. And then you have some cats that don't improve. And
As-
we don't know why.
As for
necessarily.
any therapy we can take
Yeah.
up, there's
Sadly
always a
so.
percentage.
There's
Yeah.
always
The other
some.
thing I want to make sure we point out is that even though we're injecting living cells, right, into the patient, those cells themselves are gone in a few days,
Yeah.
right?
Yeah.
They don't live there,
Exactly right.
right? They
Yeah.
do their job and then they die.
Yep, exactly
Yeah,
right. And so
okay.
there's been a huge shift in the way we think about stem cell therapy. And it used to be thought that what we wanted the cells to do or thought they were doing was going and getting into the tissue and forming new
Right.
cells themselves. And we know so much now that that is very, very, very limited.
Not really
Yeah.
what
And
we're
so
looking for.
at all. Yeah. And so what they do is they kind of talk to everybody there. So I almost think of them like a conductor. You know what I mean? You're kind of conducting something and getting everybody to do what they're supposed to do.
orchestra is all.
And they drop their drop their stick and they're out, right?
Yeah.
They're
you,
done.
less information,
Yes,
please.
yeah. Boom, I'm gone. You know what I mean? And
Okay.
so we from what we know, they don't seem to stay for very
Yeah.
long. And the nice thing about this particular type of cell is that the body typically doesn't recognize that it shouldn't be there. So
So it's expected.
exactly. So
Well
most
accepted.
most of the time, because maybe it should be there, because most of the time when we think about like cells, we think about blood transfusions and tissue transplants, and anyone who's
Or you
in that
could get a
experience is worried
reaction.
about a reaction.
Yeah,
and those
but
are pretty.
doesn't really seem to be the case.
Yeah.
Yeah.
Mhm.
They're well
So my
affected.
last question is, stem cells have kind of a bad rap. Can you talk about that a little?
Yeah, yeah.
Mm.
So I think some of the bad rap comes from, what we were talking about a little bit before is just not doing things in a controlled way, right? And nothing is safe if you're not really paying close attention to what you're doing and where you're getting cells from. So it's really important to know that the cells are coming from someone who's healthy, right? If you're getting cells from somebody who's sick, I don't know how those cells are going to work. And then knowing exactly what those cells are, making sure they don't have any infections or anything that could hurt, a patient.
Right.
Some of the bad rap, I think, comes from really the long history of getting cells from embryos, which we just really don't do anymore,
Yeah.
right? But cells coming from embryos are very different. What is an embryo supposed to do? It's supposed to form an entire organism, right?
Right.
So those cells, I call them the stemmiest of the stem cells. They can
Yeah,
stem into
yeah.
anything, do whatever they
Yeah,
want, right?
right. And that's
so
not what we want.
That's not what we want. And there's a lot less control over that, right?
Right.
And so a lot of people who think about stem cell therapy
That's what
have
they're
that
thinking.
connection
Yeah.
of like, oh, these cells are going to go into the body and just like,
Right.
we're going to get a liver forming in the nose and like,
Yeah,
that's
yeah. But
that's just not,
That's not where we're at
That's
today.
not where we're at. Yeah.
Yeah.
Mhm.
Wonderful.
So I have one last question.
Yeah.
So this is a product that is in the process of
Yeah.
coming to market. So
Yes.
we would hope to see it within 6 months, a year.
That's our hope. Yes. So
It's
we're
always hard
kind
to
of-
know exactly,
I
but
know.
it's close,
Yeah,
right?
we're close. Yeah,
Very
we're in
close.
final stages. So we're targeting having the conditional FDA approval by the end of the year. And just for people to know what that conditional part means, it means that we've been able to prove the drug is safe. That's
Yeah.
the most important thing, right? And then we've been able to show it's effective in enough cats to be able to get it to market faster because
Yeah.
cats are suffering and dying from this disease,
Right.
right?
So it's a way to
we
get
need-
it to market.
to get to help them as quickly as we can. And then we have an ongoing study that's going on now to help get us even more cats,
Yeah.
to get the full approval. And so the hope would be by early next year, that we'll have the product available and
Veterinarians
Yep.
can start.
Yep, exactly. And veterinarians can order it straight through us. They can consult with us if they have questions,
Right.
and then we ship it to them. So,
Right.
mhm.
And we'll put
Great.
we'll put a link to Gallant on our show notes on our own Cat Cafe podcast website. So people who are interested in checking it out a little bit more can
Awesome.
have a look. And then when it comes to market, they may go into their veterinarian and
Right.
say,
Go to your veterinarian.
if you've got a cat with this particular type
Yeah.
of really severe
Yeah.
mouth inflammation,
Yep.
it's good to know there's something coming.
Yep. And we have a lot on our website too, just even
Good.
for cat parents
Right.
to try to help educate.
Oh,
them.
excellent.
So, yeah.
Thank
Dr.
you.
Yeah,
Rebecca.
thank you.
We're so
wonderful.
happy.
Yeah, thank you.
Yes.
Dr.
It's
Yeah.
so
Great session.
exciting
Yeah.
to see something coming for a disease that can be so horrible. So,
Thanks for joining us at the Cat Cafe podcast, where every chat is about cats. Don't forget to follow us for more awesome episodes packed with tips and insights to keep your cat purring. Please remember the opinions shared at this podcast are those of our guest and of Dr. Susan and Dr. Jolle. They're here to inform and inspire, but always consult your own veterinarian for your cat's specific needs.